called a univentricle heart, which basically means that my right ventricle was not developed. The exact cause of all this is unknown. In most cases, seem to occur by chance. A series of surgeries would follow. I was 6 weeks, 1 and 5 years old, that they operated me. I survived, and I was sent home. 2 weeks later, my heart was failing because of a failing drainage system. I was sent to the OR, but my heart flatlined in the elevator. I was having a cardiac tamponade. This is a condition where blood and fluid fill the space between the sac that encases the heart muscle. This places extreme pressure on the heart, which prevents the muscle from expanding fully and keeps the heart from functioning properly. My heart was functioning for less than 10%. Doctors told my parents that there was no hope for recovery. The surgeon flew in a balloon pump. This is a cardiac assist device, a mechanical support for a heart in crisis, which was never tried on a kid before. I survived. And in general, my illness has been my life, but it is and it will always be toxic for every single one in my family. But besides the struggle, I have also learned to have fun with it, even when I was in the hospital. Today I am here to tell you about using my personal experience within the academical world. And since 2013, when I wasn't being able anymore to cycle for a half a mile on my e-bike, I went for my last open heart surgery. And since then, I am living with only half a heart. In the run-up to that surgery, I was scared to death not to survive this event. But I did. And from the moment I woke up on the ICU, I felt it was life-changing in many ways. But what I didn't know then was that it was also the moment that my role in patient involvement started. I started asking questions. What is that pill for? What does that readout mean? Who are you and what do you want from me? For 4 days, my heart rate told me that the external pacemaker was not comfortable for me. It makes me sicker, please slow it down. Within a few minutes, I recovered. 6 weeks later, I started cardiac rehab. I could not wait a minute longer. I was excited, but also worrying a lot. Can I go back to work again? I love dancing and walking. Was I being able to go to traveling? Can I go to the gym? Can I run for a mile? And what about cycling? Do I feel safe getting intimate with my partner again? Day by day, I got physically and mentally stronger. The standard cardiac rehab program is based on elderly people and did not, with all the respect for it, challenge me sufficiently. So I asked for a tailor-made one, which they gave me. Slowly, my quality of life increased. I am feeling blessed I have come this far. I have worked myself from an e-bike to a real racing one. I ice skated the Wijzensee and I can run for 6 miles. But having been operated does not mean the same to me as having been healed. Because my heart disease is a huge risk on getting liver failure, the doctors are monitoring me since 2019. And a year ago, I agreed doing a biopsy. I was not afraid of the possibility that the outcome could have something to do with cancer. We both wanted to know how far away I was from the next chapter, getting a double organ transplantation. Within my hospital, I am glad I am feeling I am part of the team. We truly are making shared decisions. And I am not telling you this is easy, and it's also not an organic thing to do. But my chronic illness trained me how to listen to the signs of my body. My chronic illness has trained me taking good care of my state of happiness, which is more important for me than a prescription or other possible intervention where doctors are trained for. I know I need specific health care until the day I die. The doctors help me with that, so let me help them. Why not deal with this together? And above all that, I am not my disease. First and foremost, I am a person with a desire to live a normal life. That is my reality, wanting to contribute to life and looking for something to latch on to. So I co-founded a charity called Heart for Research in 2017. It is the first platform of the patient representatives in the Netherlands that wants to build a bridge between patients with rare heart diseases and healthcare professionals working within the cardiac field. We finance research, especially those who are focused on the mental aspects of the disease. We organize lectures, meetings, focus groups, and other events between healthcare professionals, patients, and their relatives. We don't do this only to improve treatment, but also because we believe that we need to work on improving the general quality of life of patients. And since 2018, Amsterdam UMC Heart Center hired me as their communication specialist. This brought me to the same hospital as where I visit the medical team that takes care of me. It is my job to advise on how to better prioritize the patient and their experience. I investigate on how good we are doing, on what topics we need to improve, and give lectures about the diversity of patient experiences, struggles, pains, emotions, misunderstandings, and collecting the unmet needs. My illness and the way I am able to communicate about my experiences, something doctors generally can't, still feels strange when I sit next to my cardiologist in a meeting as his colleagues. He, most of my colleagues, and me are happy with me helping them and improving things. But still, there are also a few skeptics, which is good because they keep me focused. It's the art of self-criticism. When trying to increase value for patients, it's essential to look at the different needs of individuals. For example, I suffer from thrombosis, and in my mid-20s, I wanted to learn how to administer medication myself than having to go to the thrombosis center. Once I became a certified patient, when it comes to self-management, I thought bruises and bleedings comes with the job. I accepted this for years, until a fellow patient told me that I could fine-tune the auto-injector and use smaller needles for it, because the skin of a 30-year-old is different from the skin of a 70-year-old. I told the thrombosis center of these experiences, and the man at the other side of the telephone was surprised of hearing all this. A perfect example that shows that the patient group I belong to is often overlooked. Dutch healthcare is primarily equipped for babies and elderlies, because they form the majority. And we need a system in which all patients are heard. I see my role in healthcare as that of a jester. In Holland we say hofnar. It is the professional fool in medieval times that was allowed to give insight and advice to the king, but who cannot be punished for it. And in my mind, I realize as a healthcare pioneer that the purpose of my position of influence is surely to speak up for those who have none. By doing this, I hope it will bring more humanity in healthcare. Thank you.
I wish there would be much more Dayennes in our healthcare than only